Tebow, and I'm the administrator for the NOPD Crisis Unit. And for 3 years, I have been standing at podiums like this, going to press and saying, you know what, guys? We have an epidemic going on here. I call it Ebola of the brain. We have been having it for 3 years, and the response has been pitiful. I have been telling people that we have ticking time bombs out there, and it is simply a matter of time before someone or many get seriously injured. It's medical in nature. It is just as medical as epilepsy, diabetes, heart attacks, but for whatever reason, the hospitals have decided that this would be a medical illness that they would not be treating. Tulane, Turo still do not provide psychiatric beds. University is providing 15 beds at the most. This is an epidemic. Yesterday, I became a prime physical example of what happens when one deals with a person with untreated mental disorders. I responded to a call on a woman who is chronically mentally ill. She is homeless. She has been in and out of the hospitals time after time. I responded yesterday as she was receiving an order for protective custody. She was extremely violent. My finger got caught in the restraints, and I'm now being faced with surgery. This is untreated mental illness. I'm one of the lucky ones. And when I was driving over here this morning, I thought we tend to be a city that is reactionary. Let's try to be preventative. Let's try to catch this before a Virginia Tech situation happens, Lakeside Mall, whatever it may be, because it will be no fault of that person's. They are being left untreated. We have got to do something now. I'm going to be out. I'm now out of service. How many more do there need to be? Thank you.
My name's Jim Airy. I do several things for the New Orleans Police Department. Primarily, I run the negotiation unit for the SWAT team. We handle almost entirely chronic mentally ill people. Very, very rarely do we handle bad guys, because bad guys don't wait for the police to show up. These are very, very time-consuming and very dangerous when we have people with chronic mental illness who, because of their illness, their paranoia, their disease, their inability to think, barricade themselves in houses, and then my negotiation team has to work to get them out. We are our brother's keeper, and we have done a horrendous job post-flood. Pre-flood, one of the other things I do, besides working closely with Ms. Tebow, who runs the Mobile Crisis Unit, is I help coordinate all of the officers from the 8 districts when they pick up people who are mentally ill, and try and make sure that they know how to handle that safely, so that nobody gets injured in that process and it's handled quickly. Before the flood, we took almost everybody to Charity Hospital. We could get in and out of Charity Hospital, probably 15 minutes total would be a long haul. Most importantly, the nurses, the security personnel, the police officers at Charity knew the patients, many times knew them by name. The patients recognized the nurses and the officers, so safety went way, way up. Things were calm, and we didn't have wrestling matches in the emergency room because everybody knew everybody. Now, post-Katrina, and we're averaging over 230, I think last month was 230 calls for service for the New Orleans Police Department for people who are chronically mentally ill. Those calls are averaging now around 65 minutes per call. And that's 2 officers, at least 2 officers. We have to have a minimum of 2 officers to transport that person from the home to the hospital. Now we've had to use University Hospital, Tulane, and Turo, and sometimes we use Ochsner if that's the closest hospital to where the patient is picked up. New Orleans, like any other urban city, we have crime problems. So what this means is 2 district officers who should be out catching bad guys and putting bad guys in jail. We have 2 district officers who are tied up waiting in a waiting room for that hospital to be able to find a bed and provide services. What this has done is it has overwhelmed many of these hospitals because charity isn't available anymore, and it is routine for me to get phone calls from district officers saying, "Doc, what do I do? The nurse is telling me we're going to have a 12-hour wait." So think about that. We got 2 officers, minimum of 55, 60 minutes per call now, who aren't on the street doing what we all want them to do. The other thing, she probably won't mention it, Seal got hurt by a patient last night, and the patient that hurt her, we took to a hospital 3 days ago, and they didn't keep her, so she's now out on the street beating up my colleague. Well, she didn't beat you up, she just